Thank you very much, and good morning, everyone. First of all, of course, I would like to thank the organizers for inviting me to talk about this topic that is really close to my heart, which is about ontologies as tools to support microphysiological system-driven predictive toxicity screening. Now, throughout this presentation, I would like to use liver toxicity as a kind of a case study, if you will, to provide proof of principle of everything I will be discussing with you. But please keep in mind that as such, everything that will be shown here could be applied to any kind of, in this case, systemic repeated dose toxicity. Now, I assumed that several of you mainly have a technological background. That's why I decided to provide some biological background about the liver in the first few slides. So for those familiar with this, so it may sound trivial or it could be a good reminder depending on how you see it. But anyhow, so this is what you would see if you would look through a microscope and you would look at human liver tissue. You would see several 10,000s of this hexagonal structure, which is called a liver lobule, in which cells are organized radially around the branches of the hepatic vein. And at each of its 6 corners, a liver lobule meets 2 other lobules, and this area, which is magnified here, is called the portal triad that, as you can see here, consists of branches of the bile duct, the hepatic portal vein, and the hepatic artery. Well, as is the case with all of the tissues in our body, the liver also harbors several cell types, and this is shown to you here. Now, undoubtedly, the most important liver cells, so both in number but especially in functionality, are these brownish cells here, the parenchymal cells called the hepatocytes, and they really can be considered as the workhorses of the liver, if you will, because they do take care of most of the liver-specific functions, and I will be coming back to this shortly on the next slides. But nevertheless, there are also some very important non-parenchymal cell types present in the liver, which is also shown to you here. So for example, these cells, endothelial cells shown in blue, that make up the lining of the blood flow, which is called the sinusoid in the liver. And by doing so, they create this space called the space of this. And in the space of this, another very important non-parenchymal cell type is present, namely these stellate cells, which can be considered as, well, let's call them the vitamin A storehouses of the body, if you will. And then last but certainly not least, in the liver sinusoidal lumen, there are also some non-parenchymal cell types present that take care of the immunological function of the liver, which is often neglected or even ignored a bit in this area. So for example, Kupffer cells, which are residual macrophages, but also things like pit cells. You probably know that you cannot live without a liver. It's a vital organ, and indeed it does take care of a number of very important functions, and as already alluded to on the previous slide, most of these functions are being taken care of by the hepatocytes. So for example, the liver is critical in lipid metabolism, also carbohydrate metabolism, the secretion and the synthesis of essential proteins. Think about blood coagulation factors, albumin, all which are being generated and produced in the liver. As already mentioned, the storage of nutrients and vitamins like vitamin A and the stellate cells, but undoubtedly the most prominent liver function, at least from the toxicological point of view, would be the biotransformation of foreign chemical compounds, which are collectively designated as xenobiotics. And as an inevitable consequence of this very prominent liver function, the liver also represents a primary target for systemic toxicity. So that's the kind of toxicity that only becomes manifested after a chemical has been, taken up in the blood circulation. And the consequences of this can become manifested over the short term, so that's acute toxicity, so hours, days, or over the longer term, chronic toxicity, so that can be months and even years. Now all these, let's say, different types of chronic and acute systemic or repeated dose toxicity in the liver, well, they are typified by a number of very specific histopathological and clinical chemistry parameters, but what they all have in common is a certain extent of cell death and inflammation, which is exemplified here above for acute toxicity, but also for chronic toxicity. For example, in liver fibrosis, which, as you might know, is basically a scar-forming kind of process in which extracellular matrix components accumulate. And then also cholestasis, please keep this in mind because I will be using this further in the presentation as an example, which is a result of the accumulation of bile that can occur either inside of the liver, this is called intrahepatic cholestasis, or outside of the liver, which is called extrahepatic cholestasis. Now undoubtedly, let's say the most common type of chronic liver toxicity, or at least the best studied one, would be liver steatosis, which results from the accumulation of lipids, mainly triglycerides, in the hepatocytes. So they do so under the form of lipid droplets, and these droplets can be very big, as shown here, which is called macrovesicular steatosis. They're actually so big that they start to display the cell nuclei and other cellular organelles. Or these lipid droplets that accumulate are rather small, which is microvesicular steatosis. So here, the location, the subcellular localization of the organelles is not being compromised. And as you might know, if not treated, if not looked after, chronic liver disease and liver toxicity may result in the onset of liver cancer, which can adopt different formats. The most common one would be this one, hepatocellular carcinoma. So given that the liver is such an essential and really a primary target for systemic toxicity induced by chemicals, it is also not a surprise that a lot of attention has been paid and is still being paid to the development and the further optimization of what we call liver-based in vitro models. And as a result of these very intensive efforts going on all around the world, we basically have two main groups of liver-based in vitro models available today. And this is shown to you on this slide. The first group, which is still, I would say, the most important one, is the liver-derived in vitro system group. So as the name suggests, they are directly derived from freshly isolated liver or liver tissue. And they can range from the whole isolated perfused liver over liver slices, primary cells and cell lines and the different cultures, all up to subcellular fractions. And as you can imagine, they of course all differ in complexity and hence in longevity. A more recently introduced liver-based in vitro kind of system, and with more recently I mean in the last 15 or 20 years, would be stem cell derived in vitro systems in which stem cells of different origin, as shown here, can be differentiated in vitro to hepatocyte-like cells, or even, at least some people claim, full-blown hepatocytes. Now this all kind of culminated, if you will, with the introduction of liver microphysiological systems, so MPS, which is of course the topic of this very meeting. Now, as shown here on this slide, well, it's a kind of a picture that I took from a paper published 3 years ago, but I could have taken any kind of picture from the many papers that have been published, especially over the last decade, that introduce new liver MPS specifically for the purpose of toxicity testing. What they all have in common is, of course, there is the biological aspect and there is a technological aspect. With regard to the biological aspect, well, as mentioned already, of course, the main focus should be on hepatocytes, which are the most important, let's say, cells in the liver, also very frequent targets of toxicity. But if you want to be, as an MPS developer, fully in vivo relevant, of course, you need to take into consideration as well the non-parenchymal cell types. You can do this in many ways. For example, you can, generate these 3D spheroids, or you can rely on stem cell technology like organoids, for example. And on the other hand, there is also the technological aspect, and in addition to the microphysiological system as such, which kind of mimics, if you will, the blood flow, what is very frequently done in this area is to have this kind of inbuilt sensors to allow real-time monitoring or measurement of, like not only functionality parameters like albumin secretion, but also real toxicity kind of parameters, if you will. Now, myself, I'm editor-in-chief of an Elsevier journal called Toxicology, and really, in the last few years, we have really witnessed like an increase in submission of number of papers that introduce and characterize new liver MPS. But there are a couple of problems with that, because very often, unfortunately, we see that authors make invalid and honestly sometimes inappropriate claims with respect to the MPS that are being introduced here. And that is exactly the reason why a couple of years ago, together with Jan Hengschler, who is the editor-in-chief of Orcas of Toxicology, we came up with this minimum set of requirements that should be met by any kind of liver-based in vitro model, so including new MPS, in order to be eligible for reliable in vitro toxicity screening purposes. So we defined 4 criteria, if you will. I would be happy to share the paper with you if that would be of interest. So the first criterion is pretty straightforward, relates to viability, which obviously should be as high as possible during the entire duration of the application of, in this case, the liver MPS. You can monitor this by means of, like a metabolic competence kind of parameter, albumin secretion, urea synthesis, but also through, let's say, cytotoxicity parameters. Think about release of LDH, lactate dehydrogenase, for instance. The second criterion relates to morphology, and the goal, of course, here is to keep as long as possible the in vivo relevant morphology of the hepatocytes in vitro, which would be, as you might remember from one of the first slides, this polygonal kind of architecture, but especially the polarized status, and that's really important. So how can you monitor this? Well, by means of any microscopic analysis, but especially by in situ staining of typical polarity parameters or also markers of hepatocellular architecture. In my opinion, this is the most important criterion. So for new developers of new liver MPS, that would be functionality. And actually, from my experience with the submissions that we evaluate, we see 2 main problems here. So the first one relates to the benchmark, the reference that is being used by liver MPS developers. So very frequently, we see that people like to compare their system to a liver cancer cell line like HepG2. Of course, we all know that HepG2 cells, they do not perform very well, and that's even an understatement. So it's not very difficult to have your liver MPS performing better than something that is already poorly performing. So ideally, of course, the benchmark here should be the in vivo situation, but what is equally good, of course, would be freshly isolated primary human hepatocytes. Now, the second issue here is that very often claims regarding functionality are being made by authors based on mRNA expression of a number of functionality parameters like biotransformation enzymes, drug transporters, but we all know that mRNA needs to be translated into proteins and that then needs to become activated. So it's not because you have some expression of mRNA that it will be active. So that's why we really insist on, if you really want to perform an expression analysis, do this at least at the protein level, so Western blotting or in situ staining, but especially perform functionality measurements. And if you really want to convince an in vitro toxicologist like me, what you actually need to do is also show that drug transporters and also biotransformation enzymes are functionally inducible or can be inhibited. That's really, really important. And then the last criterion is, of course, something that typically relates to liver MPS that are being used or claimed to be used for toxicity testing purposes. They should be able to at least pick up, the low-hanging fruit kind of a human in vivo drug-induced liver injury. So think about acetaminophen, so paracetamol kind of necrosis, or valproic kind of steatosis, if you will. And actually, I would like to go a little bit further on this, so the use of liver MPS for toxicity testing purposes. Well, first to set the scene a bit, I think we all are aware that especially in the last 15, 20 years or so, that the field of toxicology really has witnessed a paradigm shift. So going from, let's say, the classical toxicology in which animals are used and, focus is put on apical endpoint generation towards more mechanistic toxicology, in which things like AOPs, pathways, these kind of things have a central role, and also in which non-animal methods are really essential, like in silico and in vitro methods. Well, a very relevant and a very nice conceptual tool that has been introduced in that respect is the so-called ontology. And just to avoid misunderstandings, we're not talking about a semantic ontology. It's really a mode of action framework that both quali and quantitatively integrates and structures relevant biological, toxicological, physicochemical, and kinetic data from various sources, if you will. Actually, this is what we are currently doing in a European project called Ontologies. Some of you might be aware of this. It's a European project that gathers 20 partners. I'm coordinating that project. We started off in 21 for a 5-year period. So the idea is really to go back to the biological basics, so to say. So before you want to you're able to grasp the mechanisms of toxicity, you should actually have a look to the corresponding physiological functions, because you really would be surprised how many, data gaps, knowledge gaps there are still out there. So this can be done in the form of a so-called physiological map, which then forms the basis for the pathological, toxicological situation, an AOP network, that in addition to mechanisms also should consider that is available human clinical data, and if you want to quantify an AOP, things like kinetics. And then this serves as the further basis for the actual ontology, which in practice is exactly the same as a QAOP network, with that difference that it additionally takes into consideration the physicochemical properties of the chemicals that induce that AOP, or specific key events in that AOP. So in the next few slides, I will rather quickly show you some of the, these tools that we have generated in Ontox. It's ongoing work, and I will be focusing on the case studies of liver steatosis and cholestasis. So physiological maps, QAOP networks, and ontologies. This is the physiological map for liver lipid metabolism, and obviously I don't expect you to be able to read this, but it's just to show you the extent of detail, really the granularity of these kind of things we develop. So it's being designed by, if I'm not mistaken, Cell Designer. You see some part being magnified here. It's still quite small, but just to show you that we all go down to the gene level to really, pinpoint all of the mechanisms that in this case are involved in liver lipid metabolism. And then same example, but different type of functionality. So liver bile acid metabolism, which is kind of, let's call it the physiological predecessor of cholestasis. I will be coming back to this in a minute. So here again, all of the mechanisms involved, at least the known mechanisms involved in bile acid homeostasis, and by the way, not only limited to the liver, but also outside, are typically being captured in these kind of physiological maps. So then the next step, if you know about the physiology and if you identified the remaining data gaps, is to set up these AOP networks. So again, I will be focusing here on liver steatosis and cholestasis, but everything shown here is applicable to any kind of systemic repeated dose toxicity, so not restricted to the liver. And you probably know that for most, if not all, of the common kind of adversities, if you will, under the umbrella of systemic repeated dose toxicity, we already have some AOPs available, and the go-to repository, of course, would be here the OECD AOP wiki. And that was not different for steatosis and cholestasis. When we started off, there were already some AOPs, even AOP networks available for cholestasis and steatosis, but what we actually did in Ontox is we applied an artificial intelligence technique to this. So more specifically machine learning. And why is that? The vast majority of the AOPs out there, and I checked this morning again in the AOP wiki, there are about 500 different AOPs already. Well, most, if not all of them, typically rely on manual extraction of data, which is understandable, but of course, by doing so, you kind of have the risk to miss out on data, and that is exactly why we applied or relied on this artificial intelligence technique. So here's shown for liver steatosis. I hope you're able to read this. So we started off with more than 12,000 papers that were considered eligible. So for, let's say, 10% of those papers, we actually showed the machine, the computer, on how to extract relevant data to feed into the liver steatosis AOP. So the rest was left over then to the machine. What this approach also allows you to do is do a simultaneous AOP evaluation. So an objective assessment of the, in this case, optimized AOP network, which is fully being done in compliance with the OECD tailored Bradford Hill criteria. I don't have the time to go through this in detail, but basically this comes down to answering a number of questions that relate to the biological plausibility, the essentiality, and the empirical evidence of all of the data that have been serving as the data, as let's say the basis for optimizing the AOP. And as a kind of a novel aspect, if you will, in Ontox, what we also did here is we visualized the outcome of this AOP evaluation exercise. So for instance here, the let's say the size of the edges is reflecting the essentiality of the key events. So we repeated all of this for cholestasis. What I didn't mention yet is that in terms of the machine learning technique, we actually used this sysref tool. It's a freely available tool. I really could recommend it. It's really, really nice. So here again, we did exactly the same. What is very, very specific for cholestasis, as you might know, is this very pronounced kind of homeostatic adaptive response. And this makes it a bit different compared to other types of liver toxicity, which are, let's say, mechanistically more straightforward, and which also has as a consequence that picking up or predicting cholestasis in vitro is a bit more challenging. And I will be coming back to this in a minute, so please keep this in mind. All right, so then moving to the actual ontologies, and remember that these are exactly the same as QAOP networks, with that difference that they take into consideration the physicochemical properties of the chemicals that induce not only AOPs as such, but even individual key events as shown here. But this is work in progress in the OnTox project. So how can these ontologies be used for in vitro testing purposes, and what is the role of liver MPS in all of this? Well, this is what we are also doing in Ontox, and by the way, not only in Ontox. I know that there are a lot of different efforts ongoing around the world to do exactly the same thing. So this is being embedded in a tiered testing approach. So a very common situation would be if you would have like a new molecule, you only have the chemical structure, you have some physicochemical parameters, and at best you also have some very limited toxicological data, and you would be asked to assess if this chemical has the potential, in this case, to induce cholestasis or steatosis without animal testing. So how to do that? Well, the first thing you want to do, of course, that's tier one, is just having a look at the chemical structure, which if you combine this with some in silico tools like read across or QSAR kind of approaches, will give you already a first hint, an indication of whether or not this molecule would have the potential to induce, in this case, steatosis or cholestasis. The second and the third tier fully rely on in vitro testing, and this is exactly where MPS can be used, but basically any kind of liver-based in vitro model as long as it fits your purpose. Actually, what we advise is to combine at least two different in vitro models here. So the second tier would be a holistic approach that comes down to, like omics, if you will, or RNA sequencing or microarray, if you will, to pick up a transcriptomic signature that can then be benchmarked against the AOP, if you will. And we know that this works pretty well for things like steatosis. You have a reliability and predictive value based on transcriptomics of up to 90%. But for things like cholestasis, it's only 60, 65%. I remember why that is, because it has such a complex, like AOP, in the sense that you also have this very prominent kind of homeostatic adaptive response. And that is exactly why you need to follow up by tier 3, which would be a more individual, an atomistic approach, if you will, where you do not test the AOP as such, but individual key events. And what is also important is that you don't test them at the transcriptional level, but at least at the protein level, and if possible, at the activity level. And the idea, of course, is if you would progress through this tiered testing approach, that the predictive value would increase. So in the next few slides, I would like to show you some of the results we obtained with respect to tier 2 and 3 for cholestasis and steatosis in the Ontox project. Again, I will go through this quite quickly. So tier 2 is all about these transcriptomics analysis, if you will. So the idea would here be to come up with a kind of gene signature that's the first identifier for steatosis. So this was based on expert knowledge, also manual extraction of data and literature. Well, no big surprises. We selected 11 genes, most of them that are related to lipid metabolism. Again, the situation was a bit different for cholestasis, so here we did not perform a manual kind of approach, but we left it over to the machine again. So the machine learning approach, we mined different, or at least the machine mined different kind of databases to select or to identify genes that are commonly induced or inhibited in cholestasis. So we came up with 13 genes. Some make sense already when you just look at the gene. It can be anchored to any of the key events in the AOP, but for some at first glance it was a bit strange. So then we started to dig a little bit more into the actual biological function of the genes, but it all makes sense then because you really can link it to any kind of key event. And then of course this tier 3, and this is where you set up this in vitro test battery, including several assays, each of them that monitor a key event. So these key events that we selected for steatosis from the AOP are shown here, and you can see that we have two types, so shown here in orange and in blue. So the blue ones are what we call generic key events. That would be things like, like endoplasmic reticulum stress, whereas the orange ones would be the more toxicity-specific kind of key event, like, for example, fatty acid uptake. So why do we do this? Well, the idea is to, let's say, exchange assays of these corresponding key events between different in vitro test batteries, and this will give you a reduction in testing time, but also in budget, of course, and that's exactly, what we should aim at in view of, let's say, increasing end-user application and acceptance. So this is what we are currently doing, and you can see here that the assays indeed try to pick up the key event at the protein or the activity level, and then the same is true for cholestasis. Here again, this distinction between what we call generic and toxicity-specific key events and the different assays. And obviously, you can use different kind of liver-based in vitro models like MPS to do so. All right, at the end of this talk, what I would like you to remember from this presentation is that, first of all, ontologies are really important conceptual tools for in vitro testing purposes. And secondly, is that liver MPS do play a very important role of this for the very reason that they are able that they enable actually in vivo pathophysiological relevant modeling, and that they also allow chronic and repeated dose toxicity testing. Now, of course, these liver MPS, as we have seen already in many other presentations, they can be used as standalone tools to generate really strong mechanistic readouts. But ideally, of course, if that is available, you should combine this with clinical kind of readouts in order to really cover the entire, let's say, spectrum at different levels of biological organization. Now, several of these liver MPS only allow, let's say, apical endpoint measurements, but of course, ideally, you should measure over time, real-time measurements. Why is that? Because adversity, and especially homeostatic adaptation, can, change over time. And actually, this brings me to, at least in my opinion, should be some priorities that should be set in the next few years in this area, is not only to focus on adversity as such, but especially on homeostatic adaptation and to model this in vitro. And then with respect to the specific case of drug-induced liver injury, DILI, well, as already mentioned, usually people focus on the low-hanging fruits, the A type of DILI, so the ones that are really reproducible and of which we know exactly at what concentration they should occur. Of course, the more challenging one, also from the clinical point of view, are idiosyncratic kind of reactions, which are rather difficult to predict and that also involve an immune aspect. Now, in view of increasing end-user acceptance and application, what is also very important is the validation, and not necessarily, regulatory validation, but the scientific validation. So think about things like, showing the robustness of your liver MPS and also the applicability domain testing. And last but not least, never forget that if you're working with liver MPS, you're only focusing on hazard identification, which is only one element of the risk assessment, the safety evaluation paradigm. So you should always combine this with other aspects like exposure modeling if you really want to convince, let's say, the end users, especially the regulators, if you will. And, well, the ideal, let's say, opportunity to do this are case studies, like we do in Ontox, but also in many other kind of, like efforts going around the world. So with this, I would like to thank my group in Brussels and especially our many funders. And last but not least, I would like to thank you for your attention. Thank you so much.
Thank you for that great overview. I think that really was great and give you thoughts how to use MPS models. I think we allow one question.
Hi, Maria Baltzar from Unilever. Thank you so much for the presentation and very interesting work. I was thinking when you were going through the tiers and the feasibility of AOP testing in a safety context, because you mentioned there's around 500 AOPs at the moment. If you were to do at least 3 assays per AOP, that would be 1,500 assays, which is quite a lot. So I was wondering if the objective with the Ontox and the next ones is to, once you are be able to map some of these networks and AOPs, is to build like a machine learning that could tell us which AOP should I focus on in my safety assessment, because it's not feasible to test for everything. And maybe we have tools before going to AOP to try to understand the mechanisms, and saying that we have to go always to AOPs perhaps is not necessary as well. So I just wanted to hear your opinions on that. Yeah.
Thank you very much for the good question. Actually, that's exactly the spirit of Ontox. So I was doubting whether you're a partner or not, because this is exactly what we discussed. So of course, we only have 5 years. I mean, there's feasibility. We focus on liver toxicity, kidney toxicity, and brain toxicity. It's just to set proof of principle. The long-term vision would to have first of all, an integrated AOP network. And that is exactly why already at this stage we distinguish between generic key events and, the toxicity-specific key events, bearing this in mind. The ideal situation would be if you have one big, let's say, AOP network, but that will not happen in the next 2 years. But this indeed can then serve as a kind of mechanistic backbone for, a machine learning technique. And what we try to do in Ontox is to even the in vitro and in silico testing to reduce this to an absolute minimum. What I didn't mention here, because I didn't want to focus too much on Ontox, is the first thing that we do is we benchmark against the artificial intelligence system. Actually, this is the practice of probabilistic risk assessment, which is a very sensitive topic these days, so it's not deterministic, it's not binary kind of risk assessment. This will give you an idea of the potential, the probability, if you will, of a chemical to induce any kind of toxicity. Of course, in Ontox now, the 3 different kind of toxicities, but the long-term vision would be systemic repeated toxicity as such. If the probability would be high, then you need to follow up with this kind of in vitro test battery as shown here, but only then. So that would be the longer-term vision, if you will. Integration, that's the key word, I would say.